We okay, Bill?
Yeah.
All right. As I was saying just a moment ago, just 2 days ago, a team from Jewish Hospital, Kleinert Coutts and Associates, the Christine M. Kleinert Institute, and the University of Louisville performed the 8th hand transplant surgery here on our 7th patient at Jewish Hospital. And it was July 10th that these surgeons performed a hand transplant in the Hand Care Center over the course of 14.5 hours. Our patient, 36-year-old Donnie Rickelman, who is from Linton, Indiana, which is just about 2 hours from here, had been waiting a little over a year for this transplant to occur and is now the recipient of a new left hand thanks to many individuals who gave their time to make this event possible. I want to congratulate our team, led by Dr. Michael Marvin, who will be overseeing the immunosuppressive treatment of Mr. Rickelman, and Dr. Joseph Coutts, who led the team of 15 hand surgeons to perform this procedure on Sunday. With many to thank, I especially want to thank the family that made this all possible, the family of our donor. We are very proud to be a transplant hospital and to give the gift of life, and in the case of our hand transplant patients, a better life. In fact, while this hand transplant was taking place by a team of hand surgeons, we received another call that another family would be donating an organ. Dr. Marvin was actually leading a team consulting a liver transplant at the same time. And so very excited and very proud to be part of this program in a transplant facility. As it goes without saying that while one family rejoices in the news of their transplant that has come to reality and become possible, another family is grieving the loss of their loved one. And we appreciate the courage of the families, like those of our donors, who've shown great grace in donating. We also appreciate the continued support and partnership at the Kentucky Organ Donation Affiliates, who, along with their Indiana Organ Procurement Organization, work together to make this latest hand transplant possible. Without further ado, I want to introduce Dr. Michael Marvin, Principal Investigator and Chief of our Transplantation at the University of Louisville and Director of Hand Transplantation at Jewish Hospital, to share his thoughts and updates on immunosuppression plan for Mr. Rickelman. Dr. Marvin?
Thank you, Marty. It has been a great weekend for us here at the Transplant Center. Again, I would like to reiterate Marty's comments that none of this could be possible without the donor family, and that is something that is critical and very important to stress whenever we have the opportunity to transplant the way we have over the last couple of days. I'd like to thank the team, most importantly Dr. Coutts, who was able to put together a team of surgeons and fellows and nurses and anesthesiologists that was able to make this such a success. It is an arduous procedure. I was doing a relatively straightforward liver transplant while this was going on, and my case took about 5-6 hours and his lasted 15. So I think we have a little bit of a different endurance, I guess we should say. So specifically, I want to make sure that the hands team is recognized, and that is, of course, the lead surgeon, Dr. Coutts, Dr. Tien, Dr. Moreno, Dr. Sai, Dr. Tuna, Dr. Thirkenad, and Dr. Benegas. In addition, the anesthesiologist, Dr. Yunkin, and Tonia Norris, the CRNA. There's a huge team that's involved with this, including all of the fellows, the nursing team in the operating room, as well as the coordinators on our side that perform this work and allow this to happen. It is truly a team effort, and no one individual is responsible for its success. I'd like to thank my partner in the immunosuppressive management, which is Dr. Rosemary Usif from the University of Nephrology, from the University of Louisville Division of Nephrology. She and I will be managing the immunosuppression on the recipient. Are there any questions related to the immunosuppression?
Can you tell us about the patient?
The recipient or the donor?
The recipient.
The recipient's doing extremely well right now. Is doing very well. His hand already. I'll leave some of the details to Dr. Coutts. I'd like to just stop again, and give a round of applause to the big, huge team that we have here that's working to make this a success. As far as the immunosuppression goes, it will be a standard immunosuppressive regimen based on our experience in solid organ transplantation. The drug therapy is a little different than what we used on our prior transplant in that we're no longer using Campath, we're now using a drug called thymoglobulin, which is a drug that is given over many days, 3, 4, 5 days, depending on how Donnie responds. We made this change because of some concerns about some antibody-mediated rejection that we may have seen in our prior transplant. Okay, now I'd like to introduce Marty back, and we'll continue from there.
Thank you, Dr. Marvin. Clearly, a lot of effort goes into this, and especially when you're managing 2 transplants at the same time. So we appreciate your leadership and your support of the program along with the University of Louisville. At this point, I'd like to introduce our co-investigator, Dr. Joseph Coots, who is the lead hand transplant surgeon and oversaw that team of 15 surgeons that Dr. Marvin talked about in performing this transplant. And so, Dr. Coots, would you please come up and tell us about Mr. Rickelman and how he's doing? Thank you.
First of all, I'd like to, again, congratulate everybody that's been involved. We pretty much, we have a team that goes out and picks up the organ, and that was done by Dr. TM and Dr. Benegas. And then we started with the same 2 teams that were working on, one on the donor site, which I started on the recipient site, and the Dr. TM and Dr. Benegas and one of the other fellows who started on the donor site. Now, the difference between these 2 type transfers is the difference of, I think Marty, when he does the liver, does maybe 1 vein, 1 artery, and then trying to get the liver in the right position and things like that to stabilize it. When you consider that the hand transplant, we have a lot more organs to put together. We have start out with having to put the bones together, which Dr. Marino did, and then we go ahead and start putting the vessels together, which that was done by Dr. Sy. Then we went ahead and had to do all the major tendon work, and that was done by Dr. Tuna and his team. And so it was just a team effort all the way through it. And some of the fellows then ended up with repairing. We were able to repair 2 arteries and 6 veins, which will keep the hand going much better. At the present time, his hand is working well. Now, the reason it works well is because the attachment to the muscles is his own muscles, and his muscles have always been working, so it's just a matter of putting the end point, which is the hand, on the end of the muscles, and the muscles are working well and basically doing very well. And as you know, the biggest part of this is the rejection drugs, and that's what are being handled so well by Dr. Marvin and his team. We just want to emphasize that this is always has been a team effort, and the transplants always will be. If I'm not the one in charge of it, one of the other members of our group will be in charge of it. So it's a continuation, and we hope to continue. Now, this is our 8th hand on our 7th patient. So we continue, and we have 3 more in line to, if the good Lord is willing and donors come by, to do, and hopefully maybe another one in this next year.